Okay. Hi, I want to welcome everybody to today's educational seminar with the Pennsylvania State Council of Farm Organizations. Today, we're very excited. We have with us Scott Yeager, and he is with Pennie, who, and you can correct me, but I think I have this right in saying that you are the Pennsylvania Health or Insurance Marketplace.
We're the Pennsylvania Health Insurance Exchange Authority. Publicly, we're known as Pennie. But our agency name, if you say it too many times, it'll make your jaw lock up. So Pennie is just fine.
Sounds good. Well, I'm going to go ahead and turn it right on over to you, Scott, and you can take it away.
All right. Thank you so much, Lizzie. And thank you to everyone for the privilege of your time today. I'm going to go ahead and share my screen. And if you're able to see the penny in the middle there, give me a thumbs up. All right, we're good. So I'd like to start off by sharing a little bit about what we're going to cover in today's session and why it's important to agribusiness owners here in the Commonwealth of Pennsylvania. Not only to you and to your families, protecting not only your quality of life, but your financial well-being, but also if you have employees, seeing that your employees are protected and have another option that, to be honest with you, many folks don't think about here in Pennsylvania. I'll start with our name. Most people don't associate Pennie with health insurance coverage. What does it break down to? Well, PENN is Pennsylvania, I is insurance, E is exchange. Pennie is Pennsylvania's official health insurance marketplace. Now, many of you may be familiar with healthcare.gov. And healthcare.gov, in its inception, along with the Affordable Care Act, was something significant for helping people who fall into the gray areas. Now, what do I mean by that? I mean our friends and neighbors here in Pennsylvania who don't have access to group coverage through an employer, individuals who don't have access to medical assistance because they make just a little too much, or individuals and couples who might do everything right. They might save their money, they might work hard throughout the course of their careers and ultimately find themselves in a position where they want to retire just a few years shy of qualifying for Medicare and Medicare options. Pennie is here to help. We're going to talk about all manner of reasons as to why Pennie is a viable option for so many of our friends and neighbors here in Pennsylvania. But before we dive into that, I want to take a few moments to talk about today's agenda. Briefly, we are going to discuss what Pennie is, and more importantly, what Pennie is not. We're going to talk about financial assistance because in my work across the Commonwealth of Pennsylvania, you can have the best health insurance products on the planet. But if people believe that they can't afford them, what you have is you have a boat on dry land. So we're going to talk about financial assistance. We're also going to talk about when people can enroll through Pennie, because every year, November 1st to January 15th, every single year, Pennie has an open enrollment period. That's a great opportunity for any Pennsylvania resident who is uninsured to come to us to explore their options, to see what financial assistance is available for them, and then ultimately to secure a health insurance plan that's good for their quality of life. We're also going to talk a little bit about Medicaid unwinding, and that's a unique scenario that's taking place 2023 to 2024, where through the pandemic, through 2020, 2021, 2022, and early 2023, there were about 600 to 700,000 of our friends and neighbors here in Pennsylvania that were continually protected under medical assistance because of the pandemic, who now, as of April 1st in 2023, are going to go through the annual redetermination process with medical assistance. That's important, and that's something we need to talk about. We're also going to talk about how you, as an agribusiness owner, as a small business owner in the Commonwealth of Pennsylvania, how you can help a very, very new state agency spread the word. More on that in a second. And then, of course, we'll open up for questions. But starting off, what is Pennie? Well, our official agency name here in the Commonwealth of Pennsylvania is the Pennsylvania Health Insurance Exchange Authority. You say that 3 or 4 times real fast, your jaw's going to lock up. It's not fun. Pennie, our acronym is PENN, Pennsylvania. I is for insurance, E is for exchange. Ultimately, what we are is we're an organization that was created through unanimous, bipartisan support that passed through both chambers of the Pennsylvania General Assembly. And if you think that's akin to a blue moon in Harrisburg, Pennsylvania, you'd be dead right. If we go back to 2018, in 2018, the Commonwealth of Pennsylvania, for the privilege of utilizing the federal platform, healthcare.gov, we were annually sending back about $98 million to the federal platform. Well, at the time, there were some advantages to that, but there were also some significant opportunities for the Commonwealth of Pennsylvania to take a step forward, to take local control over their own health insurance exchange. So on July 2nd of 2019, our governor at the time signed a piece of legislation, again, that passed unanimously through both chambers of the Pennsylvania General Assembly, and Pennie was born. At that point, what we were able to do is, for the Commonwealth of Pennsylvania, we were able to set up a locally controlled state-based marketplace that was, quite honestly, more responsive to the needs of the residents of Pennsylvania. And we were able to establish, for not a single nickel more in terms of taxpayer funding, we were able to establish a reinsurance program. Now, a reinsurance program acts a lot like a thermostat on the wall in your home or your office. It helps regulate the individual rates and premiums that people pay within the individual health insurance market here in Pennsylvania. So that being said, we were able not only to establish a state-based exchange, we were able to establish a program to help make sure that people could always be in a position where affordability would be at the top end of their access to quality health insurance. I mentioned quality health insurance because, let's face it, not all health insurance is created equal. There are some health insurance programs that we don't permit to be sold through Pennsylvania's marketplace. Why is that important? Well, it's important because people should, when they purchase health insurance, be able to protect their quality of life. That's first and foremost. And we have standards in place that help people achieve that right out of the gate. Junk insurance plans, we don't permit those to be sold through Pennsylvania's marketplace. So that brings me to a discussion of what Pennie is, what we do, who we serve, and more importantly, what we're not. Pennie is a marketplace. When you think of Pennie the same way you do Amazon, Walmart, Etsy. Think of us the same way you do as a farmer's market, where you have several different insurance carriers, vendors coming to a particular location. They're offering their best products. We're going to talk about that here in a minute. They're offering their best products and they're competing for the business of the uninsured or people who are in transition here in the Commonwealth of Pennsylvania. Pennie is not an insurance program. I cannot stress that enough. We're not a program. Pennie is not an insurance carrier. The largest insurance carriers in Pennsylvania, companies like UPMC, Highmark, Geisinger, Capital Blue Cross, Independence Blue Cross, PA Health and Wellness, etc. They all sell their best products through our marketplace. But what we are not is a process. Medical assistance in the Commonwealth of Pennsylvania it's a process. You apply through Compass, and ultimately it's a process of figuring out whether or not you qualify for medical assistance. Pennie's not that way. Pennie's not a process, we're a purchase. So who do we help? Well, that's real simple. We help individuals and families who don't have access to employer-sponsored coverage or group benefits. We help individuals and families who make just a little too much to qualify for medical assistance or CHIP. And we also help so many who find themselves in a position where they're not quite old enough yet to age into Medicare and Medicare options. We save those individuals thousands every year. But as a state agency, Pennsylvania's marketplace has a unique position. We have the ability to partner with other state agencies like the Department of Human Services with the end goal of making sure that people are protected in the best way possible from a vantage point that's unbiased. So from our inception, Pennie as Pennsylvania's health insurance exchange launched officially on November 1st of 2020 during the pandemic. We've had from that launch a no wrong door policy with the Pennsylvania Department of Human Services. Why is that important? Well, it's important because, again, there are individuals and families who may qualify because of their income, may qualify for medical assistance or CHIP? And if they do, fantastic. We want to make sure that they get connected with that. And vice versa. If there are people who apply for medical assistance who are not eligible because they make a little bit too much, they can come to Pennie any time of year and they can acquire health, dental, etc. through Pennie. I mention all of that to point out a couple things. We are new as a government agency, as a state agency, but we're also very, very different than healthcare.gov. We're going to talk more about that here in a second. Importantly, over the past few years, when we officially launched back November 1st of 2020, we migrated 280,000 customers from healthcare.gov to pennie.com. Since then, we have blossomed our enrollments to 371,000, and we keep growing every day. The most important thing that I can impress upon anyone today is the fact that 90%, 9 out of 10 Pennie customers qualify for financial assistance. And again, as Pennsylvania's state-based marketplace, we are very, very different than healthcare.gov. We are in a position to be more responsive, more attuned to the questions related to affordability here in the Commonwealth of Pennsylvania, and that's our goal. So moving into a discussion of financial assistance, what is unique about a marketplace and a state-based marketplace is our financial assistance. I mentioned earlier on that we have established a reinsurance program here in Pennsylvania, and that's great. That reinsurance program helps regulate the rates and premiums that people pay for individual health insurance here in Pennsylvania. But we also have advanced premium tax credits, which, to be quite honest with you, can take someone from a state of, I know I need health insurance, but I don't think I can afford it, to a position where it's like, my goodness, I didn't know I could afford it. Advanced premium tax credits help immediately reduce the monthly premium that individuals and families pay for their health insurance. Now, within Pennie, we also have cost sharing reductions. Those cost sharing reductions are aligned with our silver plans here at Pennie. They help reduce things that give you gray hair like me. They help reduce copays, deductibles, co-insurance costs. They're a really nice layer of financial assistance that, again, can help people get beyond that barrier of, I can't afford it. Just to give you an idea as to our impact with regard to financial assistance here in Pennsylvania, and this is something significant for agribusiness owners to consider. You heard me mention that we have 371,000 enrollments currently at Pennie, and believe me, it's growing every day. 1 out of 4 Pennie customers, they're paying less than $1 a day, less than $30, $31 a month for their health insurance. And it's not junk insurance, it's quality health insurance. 14% are paying less than $1 a month. So if we stop and consider for a second that the number one reason that people file for bankruptcy in the United States and within the Commonwealth of Pennsylvania is because of unmanageable medical debt. The first two tiles that you see here point out the fact that in 2023 and into the future, Pennie's goal is to make sure that our number of uninsured in Pennsylvania, which typically rests around 1 in 20 of our friends and neighbors, about 607,000 every year, go uninsured. There's no good reason why people should take the risk without reaching out, without connecting to us. We're here to help. We're unbiased. We are not insurance salespeople. We are a marketplace. We're here to serve the Commonwealth and to make sure that people stay protected. 40% of our customers, and this is very significant, 40% of our customers for quality health insurance pay less than $75 a month. That's less than most cell phone bills. That's less than most cable bills, utility bills, when you think about it. So we've got a lot of good news to share. And part of that is when people can enroll. Now, as business owners, many of you, if you currently have group benefits, you know that open enrollment, there's an open enrollment period that transpires every year. And with Pennsylvania's marketplace, yes, indeed, we have an open enrollment period. It is the one time of year when we throw out the red carpet and say, come on down. If you're uninsured, let's get you covered. November 1st to January 15th every year. But the important thing to know about Pennsylvania's marketplace is we don't just go away because open enrollment closes. Through Pennsylvania's marketplace, from January 1st to December 31st every single year, there are qualifying life events. And this is a representation of those qualifying life events that open up what are known as special enrollment periods. Those special enrollment periods are 60-day windows of time where someone who's in transition can come to Pennie, they can secure coverage, and ultimately find themselves in a place where if they don't have access to employer-sponsored coverage, medical assistance, CHIP, Medicare, they can come to us and secure health insurance. Now, some of the more common scenarios that you run into are losing job-based coverage. A question that comes up often is Pennie a viable alternative to COBRA? Yes, we are. Not only in terms of quality, because to be quite blunt, many of our health insurance plans that we have are considerably better than group plans and group insurance. But we are significantly more affordable because of our financial assistance than COBRA. You have, again, individuals that lose eligibility for medical assistance, Medicaid. In Pennsylvania, it's called medical assistance, CHIP, and Medicare. But you also have individuals who are 26 years old or older who age off of a parent's health insurance. Quite honestly, these are young invincibles, generally 26 to 34. They consider themselves extremely healthy and 10 foot tall and bulletproof. So generally speaking, these are a population of high concern for us because all too often, number one, they don't see the value in health insurance, but they also have other priorities for their funds. So we're doing a lot of outreach to that particular population. Other qualifying life events are very, very common things: getting married, getting divorced, adopting a child, having a child. Something that a lot of folks don't consider as a qualifying life event is changing your residence. Um, I'll use this as an example. Let's say someone is working in agribusiness in Lancaster, Pennsylvania, and then because of the change of the season, what have you, they then find themselves working in Butler County, Pennsylvania. Um, that change of residence is also a qualifying life event. So that's something to keep in mind. An important thing to call out is any individual in Pennsylvania who gains a qualifying immigration status, whether they're here on an H-2A, worker visa, student visa, path to citizenship, qualified refugee status, believe me, the list of qualifying immigration statuses is a long one here at Pennie. But the important thing to keep in mind, they have to be lawfully present. If they're lawfully present, oh my goodness, so many good things can happen here at Pennie. Unlike medical assistance, which has a 5-year bar or a 5-year threshold for an individual or family who's new to Pennsylvania to qualify for medical assistance, Pennie does not. More on that here in a second. But also, individuals who leave jail or prison, leave incarceration any time of year, who don't qualify for employer-sponsored coverage, who don't qualify for access to medical assistance, they can come to Pennie and we can help get them covered. Now, as a state-based marketplace, I've mentioned that we've got a lot of local control, and there are tremendous benefits to having a state-based marketplace here in Pennsylvania. One of which is being able to create new qualifying life events, like the one that you see here, where you can have an individual or family that makes at or below 150% of the federal poverty level here in Pennsylvania. Any month of the year, any month of the year, they can come to Pennie. They can shop for health insurance and secure health insurance. Now, what's so significant about this new qualifying life event that we created just this past year is it includes lawfully present immigrants who aren't eligible for Medicaid, medical assistance here in Pennsylvania, because they haven't been in country long enough. That's one way that not only are we helping agribusiness owners, but we're helping communities across Pennsylvania, period, get our newest residents, our newest workforces here in Pennsylvania protected. Another program that we created, you heard me mention before that within the Commonwealth of Pennsylvania, we created a no wrong door policy with the Department of Human Services. Well, through our partnership with the Pennsylvania Department of Revenue, we also created another program specifically geared towards helping the uninsured Pennsylvania tax filer. Now, what's the qualification? Well, it's real easy. Are you insured? If no, fill out REV 1882 and attach that to your Pennsylvania state tax return. If you do that, you'll be in a position where the Department of Revenue will transfer your information to Pennie securely. But a lot of good things happen after that. Number one, we provide you with a prepared account here at Pennie. Number two, an access code for that account, an estimate of your financial assistance. Again, because the biggest question is, can I afford it? Well, we want people to know there's help. And then ultimately, something we're going to talk about here in a second is the fact that people are never alone with regard to Pennie. There are local resources, virtual resources, and people can always reach out to our contact center. More on that in a second. Now, in terms of medical assistance, you heard me mention before that a significant event transpired on April 1st of 2023. The Department of Human Services here in Pennsylvania resumed its annual redetermination process for about 600 to 700,000 of our friends and neighbors here in Pennsylvania who, through the pandemic, through 2020, 2021, 2022, early 23, were protected through continuous medical assistance coverage. That was one less brick on people's shoulders going through what, quite honestly, for all of us was one of the most trying times in recent history. Well, as of April 1st, the Department of Human Services here in Pennsylvania resumed its annual redetermination process. Some individuals may continue their protection under medical assistance or CHIP. Some, if they're not eligible for medical assistance or CHIP, may continue their coverage through their employer. But some may not qualify for coverage or protection under either. And that's where Pennie comes in to help. That's where we can come in and literally, again, take someone from a perspective of deep concern over protecting themselves and their family, deep concern about protecting their financial well-being, and put them in a position where they've got access, in many cases, to health insurance that is significantly better than what they had prior, but also in a way where they can actually say to themselves and to their friends and neighbors, I can't believe I could afford it. So with that being said, when we serve Pennsylvania here at Pennie, and this is probably the most important slide I can share with any of you today, making a referral to Pennie is very easy. You can either go to pennie.com, and a lot of people ask me, they say, why is it pennie.com and not pennie.gov or pennie.pa.gov? Well, here's my simple response to that. If you remember that I mentioned before, Pennie was created out of a unanimous, bipartisan piece of legislation that passed both chambers of the Pennsylvania General Assembly. Our goal here in Pennsylvania is to get the GOV out of getting people protected. Plain and simple. 844-844-8040 is one resource number that people can reach out to in multiple languages. We have not only English and Spanish contact center representatives, but we also have multiple languages available in terms of translation service that we have here. And it really is a good translation service. What's unique about that number is these aren't insurance salespeople that you're referring people to. These are people that work with Pennie. These are individuals that, to be quite honest with you, they are unbiased resources. Their goal is really, really simple. Let's help get you protected. They will step through working with someone on any questions they have related to financial assistance, their different plan options in their market, making sure that their hospitals, their physicians, their family doctors, their dentists, their prescription medications are aligned with the plans in their region. And ultimately, and I cannot stress this enough, because we recognize here at Pennie that not everybody, even in 2023, not everybody likes to work online. Not everybody likes to work over the phone. In many cases, what people really want to do is they want to make an appointment with someone locally in their area that they can sit down with eyeball to eyeball and talk through their options and talk through what's available to help them get to that better place. So that's where Pennie's assisters and brokers come into play. What's the difference between an assister at Pennie and a broker? Well, you heard me mention before that our customer service representatives, our contact center staff, they are unbiased. What they can't do is make a professional recommendation to a customer. They can educate, they can inform, and help guide a customer decision. Well, they do that over the phone. Pennie's assisters, on the other hand, these are registered professionals with the Pennsylvania Insurance Department who work through hospitals, health centers, faith-based organizations, nonprofits in communities across Pennsylvania. But the important thing is, just like our customer service representatives, our assisters are unbiased. Their goal is real simple. Let's help you get protected. Pennie certified brokers are the only licensed professionals in Pennsylvania who can make a professional recommendation in its totality for the benefit of the customer and their family. That's important, especially if you have a scenario that may be a little complex. In other words, you may have a family that within the family itself, you may have pre-existing conditions, which, by the way, a pre-existing condition is not a factor in accessing quality health insurance through Pennie. Oh yeah, and by the way, it's not going to jack up your premium. That's an important thing to keep in mind. But also, where brokers really save the day is they can assess the totality of a family's needs and make sure that the health insurance plan that they are connected with covers everything. And when I say everything, I mean their family doctors, their specialist needs, specific maintenance medications, et cetera, et cetera. Brokers really shine. But more importantly, we have thousands of them throughout the Commonwealth of Pennsylvania, many of which you'll know in your community first off. We also have a chat feature. Again, it's 2023. We know that, not everybody's going to work face-to-face, online, over the phone. People are just going to want to chat back and forth on their cell phones, and we have that available as well. But we also try to be as responsive from an educational perspective as possible. Generally speaking, when you mention health insurance, most people, they'll look at you as though you've given them a glass of lemonade without the aid part. Health insurance can be a very, very challenging topic for a lot of people. We want to try and create a place that's very approachable. Hence the reason we went with Pennie.com. We wanted to create a space where people could learn on their own. And if they have questions, know that there's a lot of help available. Now, you heard me mention that Pennie is a very, very new health insurance exchange. We're a very new state agency. And because of that, again, we cannot thank you enough for the privilege of your time today. And we would hope that in your work, in your communities that you serve throughout the Commonwealth of Pennsylvania, that when people say, I don't have insurance, or I just lost my insurance, that you'd think of Pennie as an option. We have an agency toolkit that has educational materials that, again, you can request them. We will send them to you free of charge. We'll print them and send them to you free of charge. And of course, just like any other organization, we have a social media presence. We have a community partner work group meeting that is the second Friday of every month, 11 to 12. And what's unique about those meetings is it truly does provide Pennie with not not Pennie's external stakeholders, but Pennie itself. It provides my colleagues and I with an opportunity to gather information about how we can improve our services, improve our service to the Commonwealth, and ultimately become that organization, that exchange that the residents of Pennsylvania need us to be. From our launch on November 1st of 2020, we've always had an operational philosophy here at Pennie that it'll sound kind of trite, but believe me, it's what we practice. We're going to be better today than we were yesterday, and tomorrow we're going to be better than we were today. That's truly what we try to do, because the alternative is unthinkable. We don't want to see people unprotected. We don't want to see people in a position where, because of a simple accident or a twist of the ankle even, find themselves in a position where not only is their business jeopardized, but the well-being of their family. So again, please keep in mind, if you hear someone say, I don't have insurance, or someone who says they lost their insurance, 844-844-8040 is the number you want to think about. At the very least, don't hesitate to refer them to pennie.com. And again, thank you so very much for your time. Lizzie, Rachel, I'd like to open things up for questions if you have any.
Yeah, and I think we have Bill in there too, Bill Trox. So Bill, feel free to jump in. I'm encouraged to hear of all the different things that you do offer, the ways for people to connect. And I just want to add that for, with the Pennsylvania State Council, we have many associations that are part of our group. So we want to circulate this, but we want to hit that home with them that there are times they can schedule something even for their association and to delve a little further.
Most definitely.
Yeah, and I had received, this was a topic that I had actually received several people reaching out to me, asking questions about it. So that was what prompted our session here today. So Rachel,
well, Lizzie,
go ahead.
Oh, no, I was just going to say, Lizzie, to anyone who would have an interest in having Pennie come in, whether it's myself or one of my team coming in, we live in Pennsylvania, so please understand, but we live throughout the state. I live in north central Pennsylvania in Bennett's Valley where the elk are. So that basically gives me easy reach to anywhere in Pennsylvania. But I also have colleagues in Lancaster, Lebanon, Dauphin, York region, and also in southeastern Pennsylvania in the Eastern Corridor. So if there's anything that we can do to help, don't hesitate to reach out at all.
Okay, all right.
Question. I know we mentioned a lot for like business owners who don't have employers to get their coverage from. Is there any kind of benefit to going through these plans, as in like tax deductions for business owners?
Tax deductions for business owners, no. As individual business owners, yes. And let me simplify that. Pennie is individual insurance. We are not group insurance. Okay. Um, where we help is, and we do a ton of work with sole proprietors, small precision manufacturers, small business owners that, it might be a couple, it might be an individual and a few employees, or even upwards to 15, 20 employees. But where Pennie comes into play is, as the business owner, a decision is made that, you know, and in Pennsylvania, you have two options, really, if you're not going under group coverage. Employees have the ability to come to Pennsylvania's marketplace now, shop for health insurance, again, receive financial assistance. That's a big thing. And then secure that health and dental insurance. And yes, Pennie sells health and dental insurance. Some of our plans are even comprehensive. They include health, adult dental, and adult vision, which is phenomenal. That's that competition in the marketplace. But also within the Commonwealth of Pennsylvania, as an individual shopping for health insurance, you have the ability to go off market. Now, what does that mean? Well, you heard me mention before that companies like UPMC, Highmark, Capital Blue Cross, Independence Blue Cross, etc., they sell their Geisinger, they sell their products through Pennie. And this is another advantage of working with a broker. Brokers can sell on market and brokers can sell off market. And when you go off market, there's a whole host of other companies that open up. Companies like Aetna, United Healthcare, Humana. Believe me, the list goes on. That's the one advantage of working with a local broker. What's so unique about Pennsylvania's marketplace is, as an employer who would recommend to an employee, hey, you really need, and believe it or not, and I'll share this with you. In fact, I'll actually follow up with this. But we have a specific, here, give me 1 second. I'm going to bring this up. We have a specific piece that I'll send to you, Lizzie, that outlines Pennie, you and your employees, and how to help sort of conduct that discussion with an employee, rather than dive into a group plan. The employer, as well as the employees, can explore their options through Pennie. My biggest encouragement to anyone is, if you do that, please consider connecting with a local Pennie certified broker in your region. Why? Well, again, going back to what I just said, brokers are in a phenomenal position to help you as a business owner, to help your employees shop all of your options off market and through Pennsylvania's marketplace. So don't limit yourself, and heaven help you, don't think that you only have one option, because I assure you, you have more than one option in Pennsylvania.
All right. I have no more questions from my end. Rach, anything for you? That's it? Okay. Bill?
All right. Well,
I was just going to ask, the sheet that you just showed, is that a one-page thing? Does that refer at all to the brokers too, or not? Or does that just refer to the Pennie directly?
it refers to, and that's a great question, William. It specifically talks about how Pennie can help you and your employees. But the important thing to keep in mind, and please do keep this in mind, that 844-844-8040 is a quick number for someone to call and say, hey, you know what? I spoke to my boss. My boss gave me this paper, and I wanted to see if I could connect with a local broker here in my area to talk about health insurance. That's an easy way to go. Also, through Pennie.com, we have a broker search tool right on the homepage, Very, very easy to use. Basically, you type in your zip code, and within 5-10 miles, it'll pull up every single Pennie certified broker, from, again, a short bike ride to, maybe a trip across town. But that's the one advantage of that. So I will make sure that Lizzie and Rachel get the support materials, a copy of today's deck, and the educational materials. But at the end of the day, if you have questions, just call us. Believe me, we'll be happy to hear from you.
Well, I guess my reason for asking the question was whether that piece that you showed me, as you were talking, I was thinking it maybe would be useful to have. We do a monthly newsletter for our members, vegetable growers, and who most of which are small employers.
Yeah.
That it would be something that would be appropriate to put in our newsletter to alert them to what's available through Pennie.
William, that would be fantastic. And again, if you have any questions, Lizzie will have my contact information directly. Lizzie, you share that with everyone. They can call me, they can email me. The phone number that I have listed in my email signature is my business cell phone. If I'm on the road, leave a message. I will call you back.
Okay.
Definitely share all that.
All right. Thank you so much.
We appreciate you taking the time to do this with us today, because I think anytime that we can put any components of the educational part out there to the members on how to access programs, insurance is such a hot topic, and there are so many people that are uninsured that really do need the help of maneuvering through a program. So you've got your supports in place for that. It was really great too, as you went through your presentation, to point that out to us. So again, I say thank you. And we'll see. We're going to put you out there on everyone that's listening, watching this. You can go to the Pennsylvania State Council of Farm Organizations website. Members and associate members are going to be getting this in an email blast. We've recorded today's session, and we'll make sure that we include Scott's information so that you all have that. So again, thank you, Scott. I appreciate this so much.
All right, Lizzie, and this isn't goodbye. This is until next time. All right.